On the way to the hospital, I had Sarah in her car seat and my teenager was in the back seat. And she took Sarah out of her car seat and was rocking her all the way to the hospital. Mom, she's not breathing, and hugging her, and they rushed her right back. That was the worst of worst. Sarah takes $800 a month in medications, and we couldn't afford it. We were in debt with payday loans and credit card debts just from, her medicine alone. We were so protective and not letting her Sarah's niece and nephews come in over to play, because if anybody was sick, we didn't want Sarah to be exposed to it, because we didn't have coverage at that point, and we didn't want to risk having to rush her to the hospital. She couldn't go to daycare, she couldn't go to preschool, Sarah couldn't play outside in the snow, she couldn't ride her bike, Sarah couldn't go swimming, Sarah couldn't do anything. Sarah's on Apple Health for Kids now. I don't have to worry about Sarah getting sick and not being able to go to the hospital for checkups. I can get her medication every month and I don't have to worry about how I'm going to pay for it. But Sarah can go to school and be a healthy, active, normal kid. She still takes her pills. Sarah still takes puffers twice a day, and you would never know she's sick.
In 2002, my ex moved out with everything, and at the same time I discovered medical problems with my son, and I found out that I couldn't go to work until he could get stabilized. It took 2 more years before he could return back to school. So my first job took us off of welfare, which is a good thing, but it also took us away from the health insurance. One week after he finally got back on health insurance, he did fall and he broke 2 fingers. He dislocated his wrist and broke his growth plate. And so if I didn't have health coverage or got it 2 weeks later, we would have been back on welfare again to get the health coverage for that. It would have been the problem that threw us backwards again.
If they cut the Apple Health for Kids program, you're going to have even more debt, more crisis, more emergency visits. It's not right.
It's been very difficult. It's been a great hardship because I feel like I'm going backwards, not forwards. I'm just trying to live a simple, quality life and provide for my son, who's my #1 priority. His dad has been involved in his life, sees him every other weekend. However, at the same time I lost my job, he had had a job for 7 years as a computer programmer, making great money, and he lost his job. He was laid off 1 month after I was. I don't see any hope of getting back on the school district because of the state deficit, and whenever I went to the unemployment office, they said that there's 349 jobs in Bellingham right now in our county alone, and that 90% of those pay $15 or less. I can't make it on $15 or less. And just simple expenses, even with child support, I can't make ends meet. And if I had to put $700 to $800 on top of that for medical, that's more than my mortgage. It's of the utmost importance to me to have health care for my son and myself, because if you don't feel well, you can't do well. If a child is sick, they're not as successful in school. I observed that over and over again working in the school district. He can go in for regular checkups. He can get his teeth cleaned. We just found out he needs glasses. And blessings for me and for him that Apple Health Care for Kids paid for that. And I'm extremely grateful, because that's just an eye exam and glasses alone. It's $500 out of pocket that I don't have right now. I have tremendous peace and security, and so does his father, in knowing that at least his health care is taken care of in the interim of all of this, of these struggles that we're facing right now.